1 in 5 children has an emotional, behavioral, or mental illness. That's 130,000 kids just in Bexar County. If a young person in your life needs help, Clarity Child Guidance Center is there. Clarity CGC helps children ages 3 to 17 who are experiencing mental illness, no matter their ability to pay. Clarity Child Guidance Center has a unique approach to caring for children. We call it Clarity Care. Children live in a world surrounded by rewards and consequences. However, many times that technique doesn't work well with children experiencing mental illness. Clarity Care starts with the concept that all children want to do well. Our teams of clinicians work to find the root cause of why a child is having difficulty, and working one-on-one with the child to help them build coping skills and be resilient. We know Clarity Care works. From the assessments of the children before, during, and after treatment, to 9 out of 10 parents telling us they see a difference in their child. It is important to know not every child who comes to Clarity Child Guidance Center has a severe mental illness. Whether it is a diagnosis of ADHD or a child who is experiencing symptoms of severe depression, psychosis, or even suicidal thoughts, Clarity Child Guidance Center is prepared to help with the right level of care that a child needs. Clarity Child Guidance Center is located in the heart of the South Texas Medical Center. Our 8-acre campus is lush and green with a beautiful courtyard, playground, swimming pool, and above all, a focus on a child's safety with the support they need. Clarity Child Guidance Center is made up of 4 areas: a crisis assessment center, an inpatient hospital, partial hospitalization program, and outpatient services. While some families use all our services, others just use one. Understanding the treatments available can help the young person in your life. Over the next 2 minutes, we want to show you our campus and tell you more about the work of Clarity Child Guidance Center. Our video tour begins in our crisis services. Crisis services is like an emergency room for a child experiencing a mental health breakdown. This facility is open 24 hours a day, 7 days a week, and staffed with nurses, nurse practitioners, and a psychiatrist. Families can stay with their child during the entire process, where, within a short period of time, a child will receive an assessment and a treatment plan specifically designed for their needs. That treatment plan could include hospitalization, partial hospitalization, an appointment to see a therapist, or a referral to a local provider. Next, we will tour through our inpatient hospital. A child could be admitted into our inpatient hospital when they are at risk to harming themselves or others. In our 66-bed facility, children are separated into the various units based on age and gender. The ratio of child to caregiver is 4:1, and if a child needs one-on-one care, that is provided as well. While in the hospital, children will receive individual therapy and medical care. They also work in groups using our Path to Change curriculum designed to help them discover coping skills. Play is a very important factor in the care of our kids. Therapeutic Recreation, we call it Play with Purpose, is where children participate in a variety of activities from a rock climbing wall in our Mays Family Gymnasium to yoga, art, music, and spending time outdoors. Our certified recreational therapy specialists know not only how to bring out the best in our children, but to help them have fun and just be kids. Families are critical to the healing process. Families participate in their child's therapy so parents and caregivers can better understand what their child is going through and what they learned while at Clarity Child Guidance Center and can continue those skills at home. The entire stay is focused on stabilizing the child and initiating a plan for recovery. Our next stop is partial hospitalization. We call it day treatment. Day treatment is a great way for a child to transition out of the hospital or can be used to prevent a child being admitted into the hospital. Day treatment runs Monday through Friday from 8 a.m. until 3 p.m. and transportation can be provided. In day treatment, a child will participate in the same activities as a child who is hospitalized. The only difference is that child can practice what they learn when they go home, as they eat dinner with their own family at home and sleep in their own bed. Outpatient Services is one of the most utilized facilities on our campus. Our Outpatient Services offers a series of therapies to help a child, including testing, individual, family, and group therapy. Medical assessment and medication management, including a clinic provided by UT Health Child and Adolescent Psychiatry Division. Each outpatient therapy session is part of a larger treatment plan geared towards the child and their needs. Treating kids while they are kids is critical to their future success. It may be intimidating for a parent to even think that their child may experience such challenges. Asking questions, getting information, and trying to find the best support possible is essential for their healthy development. Good mental health helps children grow into healthy adults. And you are the best advocate for your child. Clarity Child Guidance Center is a nonprofit facility providing hope and healing since 1886, and we are ready to help. To access services at Clarity Child Guidance Center, call 210-616-0300.